I've been an avid inventor most of my life, with more than 40 U.S. patents, the majority of which are for implantable heart pacemakers. As a scientist and researcher, I have been following with a great deal of interest the plight of heart failure patients, some annual 500,000 new patients in the United States and 1 million or more outside the U.S. While heart failure patients are treated with a variety of different medications, they also receive implantable defibrillators, or ICDs. These devices may convert lethal heart rhythms from killing the patient, and some of them may even reduce the severity of heart failure, but none of them can assess the status of heart failure to allow for early detection and reduction of hospitalization for these cardiac invalids. I therefore decided to research the means to provide a daily monitoring technology that could be added to an ICD. That has become my mission and my passion for the past several years.
Introducing the Implantable Cardiac Assessment Monitor, the ICAM. In 2005, Dr. Scholder founded QRS Systems with the objective of developing implantable diagnostic devices to continuously monitor the heart, in order to detect changes that might improve long-term outcomes for cardiac patients and reduce the overall healthcare costs associated with frequent doctor visits or hospitalizations. The company has assembled world-renowned doctors, physicists, engineers, and has contracted with an FDA and ISO-approved manufacturing subcontractor to build its ICAM system. Subsequently, QRS has built, deployed, and tested its groundbreaking technology with stunning results. But don't take our word for it, ask the experts. We've all heard the term heart failure. Exactly what is heart failure?
Heart failure is sometimes a difficult term for people to understand, but basically the heart is a pump, and when that pump does not provide sufficient blood flow for the patient to have enough blood for their brain and their kidneys and the muscles, we call that heart failure. That's generally one form of heart failure, which is called systolic heart failure.
How do doctors test a patient for possible heart failure?
The techniques used to assess for heart failure chiefly involve a consultation with a physician to assess symptomatology and a physical examination. Most commonly, an echocardiogram will be performed to assess the pump function of the heart, and often we will then proceed with further invasive evaluation by, for example, doing a coronary angiogram to look for coronary artery disease, evidence of prior heart attacks, and so on and so forth. Rarely patients may even undergo a biopsy to look for an infiltrative cause for a cardiomyopathy, although that's very unusual. We will also measure pressures within the heart to confirm the severity of heart failure.
How are these heart failure patients treated medically?
We have made significant strides in the treatment of heart failure in recent years with a combination of medical therapies and device therapies that have improved both symptoms and morbidity and mortality from heart failure. Heart failure is associated with a 50% mortality at 5 years and is increasing in prevalence currently, with almost 500,000 new patients being diagnosed with the condition every year.
Are implantable devices used in heart failure patients?
For patients who have heart failure right now, there are a large number of devices that are used for a multitude of reasons. Some of them are for patients that have bradycardia, some have a combination of a tachycardia-induced heart failure with a bradycardia, so sixth sinus syndrome, if you will. You have patients that, in fact, have lethal arrhythmias, so they have ventricular fibrillation or ventricular tachycardia. And we know that of all the patients with heart failure, the predominant reason for them dying is from two different things. One is from sudden cardiac death or lethal arrhythmias, and the second one is from heart failure. So the sudden cardiac death or the lethal arrhythmias is addressed by the implementation of using devices called internal cardiac defibrillators, or ICDs.
What would you like to see in a heart failure diagnostic system?
So what we're really looking for in terms of treating our patients is a more reliable and a methodology with minimal, if any, additional work on our part as device implanters to watch these patients and to find out when they begin to deteriorate, and maybe even find out something that's going on prior to the deterioration. So before they even get symptomatic, perhaps we will have a parameter that says this person is going to have symptoms 2 weeks from now. Let's start doing something therapeutically today so they never get to that point.
The ICAM is an implantable cardiac assessment monitor. The ICAM is implanted in a subcutaneous pocket in the upper right or left chest area and continuously monitors the patient's heart. It wirelessly transmits daily heart failure data to the bedside monitor while the patient is sleeping. The bedside monitor receives the data and, using its internal phone modem, dials up the company server and relays the transmitted patient information. The QRS system server places the data on the company's website for the doctor to review at his leisure and also automatically notifies the doctor if heart failure has been detected. What do you envision will be the benefits of the QRS ICAM technology if it were incorporated into an ICD platform?
I had the opportunity to implant a couple of these devices in animals. And I'm impressed with the data that we've seen from these animals in terms of the ICAM's ability to track the ejection fraction of the animals as that ejection fraction deteriorated during the studies. I was very impressed with this for the simple reason it required the addition of essentially one extra step during our implant process. So if we're already putting a device in, or if a person knows how to put a pacemaker in, it's really a question of adding one additional pacemaker wire onto the septum of the right ventricle, left ventricle, the shared wall between those two heart chambers. That's an extra several minutes during the operation and requires no particular additional skill level beyond those we already have as device implanters. So we have a device that appears in these trials to track heart failure, at least by ejection fraction, very accurately, number one, and number two, requires minimal additional skill and time to implant as part of any other device implantation procedure.
QRS has developed a state-of-the-art heart failure sensing technology and have proven the concept in animals. We induced heart failure over time in test animals, and as the cardiac output declined from an ejection fraction of 70%, which is normal, to below 40% or heart failure levels, as shown by the green triangles in the graph you are now viewing. The blue curve, our sensor curve, follows the reduction in cardiac output quite accurately. Now it's time to move aggressively to make this technology available for the people who deserve to have a better quality of life. This is something we must do, and we will do.
QRS Systems Inc. Improving the quality of life for heart failure patients, reducing hospitalizations, reducing healthcare costs.